Hey everyone, so if you've been digging into the cardiovascular section of the CPT book, you know it can feel like a total maze. Today, we're going to clear up one of the trickiest parts, the general guidelines for vascular procedures. And we're going to start with a classic problem that trips up just about every new coder.
Okay, so picture this. You get an op report and the surgeon has carefully listed out 5 different steps they took during a surgery. Your first thought is probably, okay, 5 steps. Does that mean I need 5 CPT codes? I mean, it makes sense, right? One action, one code.
But as anyone who's been at this for more than 5 minutes knows, it's almost never that simple. If you've ever felt completely stumped by this, you are definitely not alone. It's a tough part of vascular coding. But here's the good news. There's one core principle that's going to make this all click.
And that principle is what I want you to think of as the package deal principle. Seriously, this one idea is your key to the whole thing. It's about changing how you look at the report. Stop seeing every little step as a separate item, and instead see the main procedure as one big, all-inclusive package.
Now, this isn't just a fun little nickname I made up. According to the CPT guidelines, the main operation, what they call the primary vascular procedure, is literally a package deal. It's not an a la carte menu where you pick and choose. It's the main course, and a bunch of the sides are already included in the price. So the million-dollar question is, what's actually in the package?
Let's unpack this deal, shall we? We're going to look at what services are automatically bundled in. And this is so important because trying to code these things separately is called unbundling. And trust me, that's a major compliance no-no you absolutely want to avoid.
All right, rule number 1, the most basic, fundamental part of the deal is this. The main procedure code always includes all the work it takes to establish both inflow and outflow. You can think of it as getting the blood to the repair site and then making sure it leaves correctly. It doesn't matter how many little maneuvers that takes, it's all part of that single primary code.
The guidelines also list out some very specific freebies that come with the package. For instance, if the surgeon does an arteriogram right there in the OR to check their work, that's included. Any extra fiddling around to make sure the circulation is good, yep, that's included too. Even something like a sympathectomy, which involves the nerves, is bundled in when it's done with an aortic procedure. It's all part of the main event.
And here it is, the phrase that pays, right from the CPT book itself. Not separately reportable. Whenever you see one of those included services in an op report, these 3 words should literally flash in your mind. It's the CPT book's way of saying, hey, don't even think about billing for this separately, it's already covered.
Okay, so we're getting a good idea of what's inside the standard package. But what happens when the surgeon does something really unique, something that isn't on the standard CPT menu at all?
Well, that brings us to a really important distinction. Most of the time, you're picking a procedure from the standard menu of CPT codes, but every once in a while, a patient's anatomy or condition is so unusual that the surgeon has to improvise a procedure that just isn't listed anywhere. Think of it as a special off-menu request. And for those rare off-menu situations, CPT gives us a special tool, the unlisted procedure code. For arteries and veins, that magic number is 37799. Now, this is your code of last resort, when nothing else fits. And a huge word of warning here, if you use it, the surgeon's documentation has to be incredibly detailed, explaining exactly what they did and why it was so unique and necessary.
So, after going through all of that, what's the one big takeaway? When you pick up that next vascular surgery report, what's the new golden rule you should have in your head? Let's boil it all down. It's this: focus on the main event, not the extras. Your job is to find the primary procedure, the whole reason that patient was in the operating room. That's your package deal. Pretty much everything else you read in that report is probably just a component of that package, not another thing you need to code. I'm telling you, this mindset will save you so much time and prevent a ton of errors.
So, I'll leave you with this little challenge. This whole package deal idea, it's not just for vascular surgery. It's the fundamental concept you'll see all throughout the CPT book. Now that you know what it looks like here, where else do you think you'll find it? Keep that question in your back pocket as you keep going. Until next time, happy coding.